I'm just going to come right out and say it. That free hearing test that you got is probably the reason why you don't hear very good. Hey guys, welcome back to the DrCliffAuD vlog, and today I'm talking to you all about these free hearing tests that you get from hearing aid clinics. But before I do me a huge favor, click the like button, really helps out the channel, and if you are not yet subscribed to the channel with notifications turned on, go ahead and do that as well. It is greatly appreciated. So let me provide you with a little bit of context here. Ever since audiology was a thing, or even really hearing aid dispensing was a thing, there was free hearing tests, all right? A lot of times you would go in, you'd have difficulty hearing, you call up a clinic and schedule an appointment, they're like, yeah, come on in, we'll test your hearing for free, and then we'll make a recommendation on the optimal treatment to treat your hearing loss. And it was essentially a very streamlined process where they didn't have to really do much to encourage you to schedule because it was free anyway. You're basically just spending 30 to 45 minutes of your time to find out if you have a hearing loss and if you actually needed hearing treatment. Now, decades ago when this was happening, testing was very basic. You had pure tone air conduction, bone conduction testing, and speech testing, and that was pretty much it. But what this did is it set the standard for what a hearing test actually is. And so nowadays, even though we have a lot more testing that we can do on individuals and a lot more time that we spend on them to identify exactly what their wants and needs are, it is unheard of to pay for a hearing test. Now, this is changing a little bit because there's a lot of clinics out there that follow comprehensive best practices that are like, listen, we've got to do way more testing, we've got to spend way more time with patients to make sure that we get an accurate evaluation and to make sure that we understand everything that this patient needs to be able to hear. But it doesn't change the fact that the majority of clinics that are out there will still give away a hearing test for free, but they also want to make sure that they limit the amount of time that they're spending with the patient, because anytime someone doesn't have any quote-unquote skin in the game, they're unlikely to actually accept the recommendation of the hearing care professional that they're working with. But this mentality has carried on for literally decades inside of the hearing aid space, and so a lot of individuals who've been tested before at different clinics expect to have a hearing test for free. But at the end of the day, that hearing test may be the exact reason why these individuals continue to struggle hearing. So I want to share a quick little story with you here. We had a patient call up the clinic a week or two ago to schedule a consultation. Now, our consultations inside of the office are 2 hours long, and we have a very comprehensive hearing test that goes along with that consultation, because we need to make sure that we have enough time to fully diagnose the individual's hearing loss and determine everything about their auditory system that would have an impact on how we treat that individual. But when we got to the end of the scheduling phone call, this person was kind of taken aback because we actually charge for these consultations inside of my office. Now, this individual begrudgingly scheduled because she had gone through decades of free hearing tests and horrible performance with her hearing aids. And she really wanted to have one of our applied 360 review consultations to figure out exactly why she was struggling so much, and so she could be guaranteed that she would receive real ear measurement if we were to go in and either reprogram her existing hearing aids or get her new hearing aids. But you know what happened a day or so later? She ended up calling back and canceling her consultation appointment. And the reason why is because we were going to charge her for it. Now, anytime someone cancels an appointment and doesn't reschedule, Ashley ends up calling them to find out why they did, because sometimes there's just a misunderstanding, she gets them back on the schedule, and all is good. But in this particular instance, kind of a funny situation, so Ashley calls the individual answers the phone, but she didn't know that she did answer the phone. She thought she actually rejected the phone call. And what ensued next was honestly quite hilarious and ultimately disappointing. What happened is that Ashley stayed on the line because she thought the person had answered, and the person started talking, but not to Ashley on the phone. She started talking to someone else who was in the room with her, maybe her daughter, maybe her husband, maybe someone else. And what she was explaining is that, oh yeah, that was the clinic that I scheduled a consultation with, but they ended up charging for the consultation, so I called and canceled it, and now they're trying to get a hold of me again. And the person that she was talking to basically said, whoa, hold on. They charge for a hearing test? That doesn't make any sense. Everybody gives away their hearing test for free. Just go to some place that does it for free. So basically, this other individual validated this individual's perspective on if they should or should not be paying for a consultation and a hearing test. And Ashley's hearing all of this conversation happen, and you can imagine that Ashley is just crushed by this because this person's scheduled because they continue to struggle with their hearing, and every place that this individual had gone in the past did not follow best practices. And the free hearing tests that she's been getting have been so lackluster that it doesn't even set her up for success if she does treatment with these clinics. And so essentially, because this person refuses to pay for a comprehensive auditory evaluation, she's going to continue to struggle and spin her wheels with all of these clinics who just want to get her in, give her a free hearing test, and sell her the next set of devices. Now, there are a lot of things that can negatively impact someone's performance with hearing treatment, but I have to say one of the top variables is whether or not the clinic that's treating you gave you a free hearing test. Because if they're willing to give you your hearing test for free, it usually means that they're motivated by making a hearing aid sale and ultimately not following best practices when they do your treatment. Now, this is not in all cases. There may be some clinics out there that give away free hearing tests, do a very detailed job of those hearing tests, and then follow best practices from the beginning of your treatment to the end of your treatment. But I would have to say that the percentage chance of that happening is very low. So at the end of the day, you have to ask yourself, is saving a couple of $100 to get a free hearing evaluation worth potentially sacrificing your overall treatment from now until forever? And if that is worth the risk for you, then I say go ahead and schedule a free hearing test and cross your fingers and hope that you actually do well with your hearing aids when that clinic decides to treat you. But I'd like to hear from you. Let me know down in the comment section if having to pay for a hearing test is a complete deal breaker for you. Because in my opinion, getting a free hearing test is ultimately setting you up for failure when it comes to your overall hearing aid treatment.